आज फिर होने को है आगाज़, सफर पर चलने का बढ़ने का। इतना है हौसला जितना भी फासला, मंजिल तय मिल ही जाना है, हम में है।
हौसले पे सवार आगे बढ़ रहा है इंडिया, और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज होने को है आगाज़, सफर पर चलने का फासला, मंजिल तय मिल ही जाना है, हम में है।
हौसले पे सवार आगे बढ़ रहा है इंडिया, और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज़, सफर पर चलने का बढ़ने का। इतना है हौसला जितना भी फासला, मंजिल तय मिल ही जाना है, हम में है।
हौसले पे सवार आगे बढ़ रहा है इंडिया, और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज़, सफर पर चलने का बढ़ने का। इतना है हौसला जितना भी फासला, मंजिल तय मिल ही जाना है, हम में है।
हौसले पे सवार आगे बढ़ रहा है इंडिया, और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज़, सफर पर चलने का बढ़ने का। इतना है हौसला जितना भी फासला, मंजिल तय मिल ही जाना है, हम में है।
हौसले पे सवार आगे बढ़ रहा है इंडिया, और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज़, सफर पर चलने का बढ़ने का। इतना है हौसला जितना भी फासला, मंजिल तय मिल ही जाना है, हम में है।
हौसले पे सवार आगे बढ़ रहा है इंडिया, और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज़, सफर पर चलने का बढ़ने का। इतना है हौसला जितना भी फासला, मंजिल तय मिल ही जाना है, हम में है।
हौसले पे सवार आगे बढ़ रहा है इंडिया, और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज़, सफर पर चलने का बढ़ने का। इतना है हौसला जितना भी फासला, मंजिल तय मिल ही जाना है, हम में है।
हौसले पे सवार आगे बढ़ रहा है इंडिया, और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज़, सफर पर चलने का बढ़ने का। इतना है हौसला जितना भी फासला, मंजिल तय मिल ही जाना है, हम में है।
हौसले पे सवार आगे बढ़ रहा है इंडिया, और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज़, सफर पर चलने का बढ़ने का। इतना है हौसला जितना भी फासला, मंजिल तय मिल ही जाना है, हम में है।
हौसले पे सवार आगे बढ़ रहा है इंडिया, और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज आज फिर होने को है आगाज। सफर पर चलने का बढ़ने का इतना है हौसला, जितना भी फासला मंजिल तय मिल ही जाना है। हम में है
हौसले पे सवार आगे बढ़ रहा है इंडिया और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज। सफर पर चलने का बढ़ने का इतना है हौसला, जितना भी फासला मंजिल तय मिल ही जाना है। हम में है
हौसले पे सवार आगे बढ़ रहा है इंडिया और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज। सफर पर चलने का बढ़ने का इतना है हौसला, जितना भी फासला मंजिल तय मिल ही जाना है। हम में है
हौसले पे सवार आगे बढ़ रहा है इंडिया और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज। सफर पर चलने का बढ़ने का इतना है हौसला, जितना भी फासला मंजिल तय मिल ही जाना है। हम में है
हौसले पे सवार आगे बढ़ रहा है इंडिया और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज। सफर पर चलने का बढ़ने का इतना है हौसला, जितना भी फासला मंजिल तय मिल ही जाना है। हम में है
हौसले पे सवार आगे बढ़ रहा है इंडिया और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज। सफर पर चलने का बढ़ने का इतना है हौसला, जितना भी फासला मंजिल तय मिल ही जाना है। हम में है
हौसले पे सवार आगे बढ़ रहा है इंडिया और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
दिल धीरे धीरे धड़के आज फिर होने को है आगाज। सफर पर चलने का बढ़ने का इतना है हौसला, जितना भी फासला मंजिल तय मिल ही जाना है।
No. Hey, hi Himanshu.
Hello Shobhani, how are you?
I'm good, thanks so much. I'll give the opening remarks. I introduce all the speakers. Online here is Madhukar Bose. Good evening, Mohammed Yasser. I can see, and then I think
Shobhani.
Dr. Vikram. Hi, from, uh, and you. So who do we have missing? I think we have. Ravi Limai is missing, right? He's the only one. And Dr. Michael Joseph, Brunel University. We have the order. Gentlemen, please, apologies for this. I have a sudden health thing, a health ministry thing that called, hospitals and vaccines. So at 5:30. So I'm going to give the opening remarks and just listen to a little bit of it. And if you don't mind, I'll have to step off. Maru. Hi, Maru.
So after you do the debate,
Yeah.
then you can hand over the moderation.
Yeah, I'm online with him, so I'll do that. Say hello to all the speakers and introduce the people that we have, and hand over to Himanshu.
Shobhana, you're on mute in case you're talking to us. I didn't know whether you're on the phone or not.
No, I was just, that was Maru. So, I really miss being there in person. Then there are no excuses not to be present all the time.
Yes, I think the way we run these virtual events there's the temptation to do more than we can, practically speaking, and then we kind of fall between two things rather than being in one camp.
I completely agree with you. And now the world has become so funny. I was complaining to Chandrajit the other day when he came to Hyderabad after a long time, and I said, now our world, so much of it remains virtual, but it's also become physical again. So we're toggling even more than what we had earlier. So are you seeing that also?
I think still it's quite virtual, but Shashank and I will be meeting next week in Birmingham. So that's going to be, my first in-person event in about 18 months. So that will be an interesting experience to see how these things are trying to get back to the old norm.
Yes.
Okay, we have 1 minute, and may I just request that we keep opening remarks short, so there's more time for a panel discussion. Hello, Michael and Ravi.
Hi, good afternoon, Shobhana. Very nice to meet you, and nice to meet you all.
Thank you. Rika, shall we start?
Yeah, ma'am. Yeah, we're almost on time. Yeah, I think we can start. Everybody is there. Welcome to everybody, and request Shobna ma'am to please start the session. Thank you.
Good afternoon, good evening, depending on which time zone you're in. Big welcome from me personally and CII. We're very privileged to be at this annual India-UK conference. This is a sectoral session on the India-UK healthcare bridge, and focusing specifically on a subject that probably many of you have done to death and heard so often over the last 2 years. Nevertheless, the importance doesn't cease, and we will focus on the pandemic response and the global lessons learned. With me today, I'm really happy and privileged to share this dais with Dr. Madhukar Bose. He's the Deputy Head of Healthcare, Digital Health, the Department of International Trade, UK. We're very fortunate also to have a medical doctor, but his role today is in his capacity as the Consul General of India to Birmingham, the High Commission of India, Dr. Shashank Vikram. So welcome to you too. Dr. Michael Joseph is the Vice Chair, Public Administration Committee and the Joint University Council of the University of Brunel in London. So he joins us with his wealth of experience in healthcare and medtech, and especially innovation. So I think that you're seeing a broad theme and a range. So with me is Mr. Ravi Limai, who's the Managing Director of Wockhardt UK, pharmaceutical manufacturer of repute. From the pharmaceutical sector, we're also joined by Mr. Mohammed Yasar, who is the head of the UK generics business of Dr. Reddy Labs, and he's the country head of UK. And my fellow moderator of this session is Mr. Himanshu Bai. Himanshu is the Managing Director of one of India's largest medical consumable companies, Polymedicure Limited. So as you can see, we have a wide range of speakers who can give you 360 perspective, because each one of us, while at the end of the day, it was the patient or the ultimate customer was one, but all of us had such a different view. So, and I think that's what would be most exciting to hear today, that the availability of a 360-degree view on this. So let me state before this panel starts that healthcare cooperation between India and UK is vital and strategic. It's been going on for many years. It's something that we have to commit more and more to. At the virtual summit in May 2021, the UK and India announced a 1 billion of new trade and investment as part of this new enhanced trade partnership. And Indian investments worth 533 million were made in Britain, and of which 420 million came from the Serum Institute, who said that they will set up facilities there in the UK. And I think the production of the Oxford AstraZeneca has been the cornerstone of great partnerships, and there is nothing short of whatever we can say to praise this partnership, because it's actually resulted in the saving of so many lives and the reopening of the Indian industry and the whole economy. Because even today, they have almost 70% of all vaccines are the AstraZeneca Serum Institute vaccine, which is manufactured here in India. So we jointly with UK send them our thanks, and think it's a definition of a fantastic partnership. And I think that the prime ministers of both countries have appreciated the role that has been played in the pandemic by the Indian companies and the UK companies. So what more can we do? Within this, crisis is not over. So there's a role that can be played now, but there's also a collaborative role that we can use learning models from now to be able to take into the future. From Apollo Hospitals, personally, as I can share, we opened a medical university there in the UK, and we're not only will we be training doctors, but right now medical other fields of medical practitioners. And I think that's the excitement, to be able to have a collaborative effort using the best of what the UK has in terms of education and learning and training, and taking that globally. So what can we do 1+1 and take it to the world in education? And we'll hear more about that later. But having said that, I think that the opportunities also exist to be able to serve the underserved, not only, from the UK, we've had many, like King's College and others, even the University of Brunel, who said that they want to create partnerships in India to be able to see what it is that we can do to serve the most underserved here and bring down the cost of healthcare. The same way that we can have partnerships of going to the UK and working with the NHS. The next part of that is, of course, the pharmaceutical industry that we have here, very strongly represented. It's always been pre-Brexit, post-Brexit. The UK does form the cornerstone of the strategy for that geography. For almost, if not every serious manufacturer in India has a presence there. And I think that presence will continue to be strengthened. But we will take it one dimension further of the very successful innovation model that we've seen in pharma that has taken place with the Oxford University, and move that. So innovation now will take center stage in a healthcare play post-pandemic. And having said that, I think that people like Himanshu will be speaking to say it doesn't stop there. It's the medical devices that will also play such a great role. The fact that, and I think from devices, it's also innovations and technology and the new age digital health. This is something that I'm personally involved with. In the pandemic, we saw patients that did not have access to doctors. We had, in many ways, we found that the need for digital health solutions fast and furiously to move to be able to get to patients. And I think that this is something that in India, we're moving towards digital health. I think that it is, we had some numbers recently. By 2030, it's slated to be a $300 billion opportunity of digital health in India. And I think that this is something that many countries, and UK has some great companies that we've had discussions with, but together collaborating, there's opportunity not just in India, which is a big market that requires the access and technology, but it also has the digital bandwidth, which is available to be able to get the best in the world to leapfrog. So I think from both sides, it'll be a very interesting debate, not just today, but going forward in the future. And that, to me, in closing, is what the CII collaboration is all about with the UK. It's the opportunity to meet fantastic people like yourselves. It's the opportunity to interact. Virtually is not always the best way. So I've done it several times physically, and I found that it's created lasting partnerships. But we will, as the pandemic has taught us, we will make the best use of every opportunity. We will overcome every crisis. And I think this is a time which is healthcare's time. And we mustn't let the world forget that there's every company, every individual needs to be health first. So with that, I hand over to this wonderful panel and thank you again, speakers and the audience for being here today. And we look forward to a safer world in future and doing it right. Thank you. May I request the first speaker, Dr. Madhukar Bose, or Himanshu, we'll just take it in the order that we have, right?
Okay, I'll take over. Thank you, Shobhana. I'll take over.
Okay.
I know you have to rush to the ministry, so I'll take this over. Thank you very much.
Thank you.
And I request Dr. Madhukar Bose, Deputy Head of Healthcare Digital Health, Department of International Trade, UK, to give his opening comments, please.
Thank you, Himanshu. Thank you, Shobhana and CII for the invitation to participate. It is a fascinating last 18 months that we've been through. And the lessons that we have learned and still learning, I think. So I'm just going to talk very briefly, if possible, about three main areas of learning. Now, Shobhana touched upon the first one in a bit of detail, that is, how can we increasingly rapidly accelerate the production and development of vaccines, therapeutics, and diagnostics. We've seen the art of the possible completely change through the pandemic, and I guess we've talked about the Oxford AstraZeneca collaboration, and Wockhardt is also playing a key role in that. So from a India UK collaboration perspective, it has thrown up some excellent examples. I think there is more potential to do things like sharing of clinical trial data and clinical trials across two countries, because in the UK, what we have started doing through the pandemic is accelerate clinical trials through the use of platforms like the NHS DigiTrials platform, which allows recruitment of patients to be done through electronic patient records, and accelerate that, because that's often one of the slowest steps in a clinical trial. So I think, if those sorts of platforms are available and we can share information, share trial data in a way that regulatory approval allows, then that's another step that we can take forward. And I think I'll move on to my second area, and that is the how do we deliver public health and primary care type interventions through the use of technology. And that is not just in terms of sort of remote consultations and video consultations. That's fairly easy and standard. But what we saw through the pandemic was the use of the digital front door for the NHS. The NHS app, and later on, the contact tracing element became more and more robust and played a strong role there. But the use of the NHS app, the use of digital, that sort of initial interaction being through the digital channel, and that became quite an important element of allowing the NHS to handle that initial volume of inquiries that were coming in. And also there was an AI-based triaging that was applied, so that patients coming in with inquiries could be routed to the right part of the health service, rather than clogging up in-person appointments, which were then being used for the patients that needed it most. And these sorts of technologies have been really one of those eye openers for the NHS. And I think I really hope that we don't go backwards in that respect, and we continue to use some of those post-pandemic. And the last bit I want to say in that respect is also the genomics element, because through these advanced platforms, we've been also not just looking at individual genomics, but also using the genomic analysis of the virus itself to understand it better, and therefore help us to actually develop therapies and therapeutics to address it. Those were my first 2 points. So the final point I wanted to make was around the creation of flexible, scalable, and resilient capacity in the health system. And that covers a few different things. That covers facilities. So how do you create rapid facilities where you need surge capacity? So you had the creation of Nightingale hospitals in the UK. And although they didn't get utilized as much as we had feared at one point, but it certainly was there. It was created, was there. It was ready to take on that load should it be required. The second is services. Now, when you have COVID, the risk is that you have oncology and cardiology and patients who require those kinds of critical care services often get left behind and aren't served as well as you would normally do. So there were the creation of separate commissioned services, specialized services, and there you had some partnerships between the private sector and the NHS that allowed the extension of capacity into the private sector. The private sector kind of playing a role in delivering services to the NHS. So that kind of contracting model, that kind of flexibility in the system is really important. And I think the staffing element goes along with that. So how do you create extra workforce? And the final point was around supplies. You had shortages of paracetamol, you had oxygen supplies, which we work with the High Commission of India to source oxygen supplies from the UK going out to India. And also things like PPE and test kits and things like that. So my team was repurposed through the pandemic to, forget our day job of enabling trade and exports and all of that. And it was all about finding the supplies for the NHS in the initial stages, and then helping Government of India find supplies from the UK. So I'm going to stop here with those thoughts, but yeah, that's how I kind of encapsulate my view of lessons learned. Thanks
Thank
so
you,
much.
Dr. Madhukar. I think you've shared a lot of important things, and I'll come back to them a little later. When we have our open discussion. I'd like to invite Dr. Shashank Vikram, Consul General of India, Birmingham, High Commission of India. So, Dr. Shashank Vikram, over to you. Thank you, sir.
Thank you so much, Himanshu ji, and thank you, Madhukar ji, for his insights. See, I would just take it a bit forward from what Madhukar was discussing. From the point of view of Government of India, since the beginning of this pandemic, entire world has seen the way in which India was among the first countries to take stringent measures when it came to lockdown to stop the first wave of the pandemic. And as rightly somebody mentioned, our strength in pharma sector was shown when, as the pharmacy of the world, we supplied medicines, whether it was paracetamol or, hydroxychloroquine and so many others. And then after the push came, and then the Oxford AstraZeneca thing, I think it is one of the very good models which actually shows a UK innovation which was put to scale in India, and it helped entire humanity, I would say. It went all across developed and developing world. And it once again, brings us to the same point that between UK and India, the healthcare sector has been identified as a priority sector, and it is because there exist very strong complementarities between the two systems by which we can benefit, and the UK can benefit for Indian experience and India can benefit from the UK experience. But one thing I would say that what COVID-19 pandemic has also taught, it is something very basic, which I think we all, which all doctors see in their first year of education, that, the health of human beings is basically indivisible. It is the same for you and me and for everyone. So when the health is indivisible, so how can healthcare be in different silos? It has to flow. There has to be an experience. There has to be a flow of men, money, and material when it comes across the board. So between India and UK, I see that there is a lot of scope when it comes to training, when it comes to movement of people. Today in this world, this circular economy, people move from one place to another, gain some skills, and may tomorrow go to a third country for it. Like Oxford AstraZeneca, we mentioned, and it is a great initiative, but the fact is that is still there is certification issue going on when it comes to vaccine certificates from India. So those are little things, and same I would say for R&D, because India is now very strong in R&D, and UK has its intrinsic strength in that, with so many institutes of repute who have been doing it, and NHS itself has so much of data and so much of work going on. But the need of the hour is, I think, to to ensure that there is a smooth flow. There is a smooth flow of these ideas. There are mechanisms put in place to ensure that there are easy R&D qualification. It's easier to scale up and implement things. It is not qualifications and things like certifications and mobility doesn't remain an issue. So as we go forward, I think that is what pandemic has taught us actually. Because you have a common foe, you can't have different ways of dealing with it. And entire world has seen, I don't think so that before this was there, anybody would have thought that a little virus in some XYZ part of the world will reach them in a matter of days and will affect so badly. And this has happened. So I feel that the response as we go forward should be something where people match their strengths, collaborate, and go forward. And actually, as Madhukar just mentioned, in order to take this dialogue forward, we are organizing India-UK Healthcare Conference in Birmingham next week, which is on Monday and Tuesday. And there we will undergo many such issues, whether it is collaboration in digital health, collaboration in pharma, life sciences, for ensuring accessible healthcare to all, also COVID-19 and post-pandemic issues, holistic healthcare, and so many different issues. So the idea is to take the dialogue forward, and without taking, I think, any more time, I would say, we need to simplify and rectify where there are issues and amplify the collaboration. Thank you.
Thank you very much, sir. And thank you for your comments. And I think you stressed on this idea of training and, moving skilled people. I think that's a very important area, going forward for collaboration. And with this, I move on to Dr. Michael Joseph, Vice Chair, Public Administration Committee, Joint University Council. Dr. Michael, over to you for your comments, opening comments, sir.
Thank you. Good afternoon. Can you hear me?
Yes, sir.
Yes, thank you, Himanshuji. Thank you, CII, for inviting me, especially Brunel University. So my main job, I work in Brunel University, London, to manage research innovation partnerships in healthcare and medical technology. Before I go to the main topic, I just want to take a case study of pandemic influenced one of the national health innovations from India and UK, and to compare that process. Before, some of you know Brunel University, some of you may not. So I just thought a couple of seconds, if I may. So we are a 1960s university based in London, quite creative in our founding motto, that to bring benefit to society through excellence in education, research, and knowledge transfer. And we have been doing this in different ways. For example, with the CII, we have quite a good relationship. Our innovation hub in Brunel was inaugurated in 2014 by Lord Bilmoria, who is an important person in CII system. And also we have around 1,500 Indian alumni members who also benefited from some of this incubation funding we have for students, and who are now doing really well in their development. And finally, I would also say, with CII, the young Indian entrepreneurs come to UK, or with CII, they have been also given some exposure, skill strengthening in terms of research innovation. And some of them did come from pharmaceutical background as well. So I just want to say, so it has been always a pleasure to support the young entrepreneurs. And I will also make an announcement here. We have a provision for 9 fully funded PhDs for who are working in the UK. If any of the CII members, their Indian UK chapters, if you want to recommend people for full-time PhD, we will cover their fees, we'll top up their salary as well. So, but they should be employed in the UK, focusing on net zero energy. So sorry for that initial announcements here. But now coming to my main topic of discussion on comparing national health innovation, I'm taking here, some of our colleagues already mentioned about innovation, the COVID track and tracing system. So this is something, the innovation in general context is classified in 4 categories, product innovation, process, marketing, and organization. So, from a national health innovation in the post-COVID, because I did some work on this is my area of, interest as well. So, in the UK, NHS app, trace, alert, check-in symptoms, and test and isolate, with that focus. Again, same for advocacy too as well. So, so I just want to show how, it's used in the UK, for example, we have 12 languages of NHS app. Of course, in India, we have all state languages. So now, of course, if there were lots of time to explore, how its effectiveness, of course, we don't have that much time today. But some of the things when I worked with the colleagues in India, Central University of Kerala and Manipal Medical College. So, the effectiveness of the intervention. For example, a study from Harvard. It showed, it's 2021, focusing on Washington, DC experience. If 15% of the population used an app, that notification, of a response to an infected person, infections were reduced by 8% and death by 6%. Of course, it is a very, very micro study. I know there would have been other studies in the Indian context. In the UK, we are still doing some analysis. Again, I just thought for us to keep in mind in terms of some of the overall aspects of health innovations. And of course, data protection and behavior dimensions is also an important thing to take note of in the context of national health innovations. For example, in the UK, even ownership of smartphones, we think everybody has. No, it's only from 10 to 30% of the population have access to smartphones. So again, we know the use of then app is very limited to only as a type of population. Say my own experience, I went to a very upper middle class British neighborhood, mostly white looking people there. So it's a place of worship. It's a Christian place of worship. I thought, everybody would have used app there. So I was like, one of the Desi looking person going there. So they said, what is this? I said, this is an app. Do you have a scanning facility there? Oh, no, we never use this. You are the first person to use this. This is most probably after eight months of COVID, So it's not widespread. So again, there are issues with behavior dimensions when we look into national health innovations. Of course, socioeconomic returns is another factor. Then regulatory dimensions. So in India, I think at the beginning of COVID, we had around, I think, over 35 to 40 apps developed by different groups and different state governments. So, it may be needed at that time, but of course, then we have the national app that came in with advocacy. So again, there are these regulatory dimensions very important to keep in mind if you have to encourage people about the data protection and widespread use. So I conclude there because of the lack of time for us. So I just want to say, again, this particular analysis I've done with colleagues from Manipal Institute of Higher Education, Karnataka, Dr. Prakash, Dr. Elizabeth from Central University of Kerala, and then Dr. Raman Swati Vaman from Government Medical College in Karnataka, just to share some insights on how we work. So I just want to say thank you, and then happy to discuss any of these points, and more importantly, the earlier announcement I mentioned about this collaborative PhD for skill development for employed people in the UK from CII members. Thank you for this opportunity.
Thank you very much, Dr. Joseph. And I think definitely, we will, pass the information to various CII offices across the country, and then they will come back to you if they have any students available for scholarships or they want to join the PhD program at the Brunel University. So thank you for that, announcement. And now I'd like to move to Ravi Lime, who is the Managing Director of Vocard UK. Ravi, over to you. I'm supposed to speak, but I'll come at the end and talk a little bit about medical device industry and medical technology. But Ravi, over to you.
Thank you, Himanshu. Good afternoon to everybody, and thank you for this invitation to participate in this roundtable conference. Let me start by giving a little bit of introduction about what Vocard does in UK. So we have been in UK for over 2 decades now. We are one of the big suppliers of critical care medicines to the NHS. We have a sterile injectable manufacturing facility here in UK in Wrexham, which is in North Wales. We employ about over 500 people. As I said, we basically produce injectables, and we basically produce injectables in critical care. We have become a little bit famous in the last 1 year here in UK, because we have been associated with the manufacture of the AstraZeneca Oxford vaccine for the government of UK. And I must say that I'm proud to report that almost more than 50% of all vaccines deployed in UK would have come from our site here in Wrexham. And we are now not only been supplying to UK, but we also started supplies to Europe and also to the COVAX countries through the United Nations and WHO. And I must say that this last 1 year has been very hectic, but has been a matter of great pride. It's not very often that we get to contribute in such a big way to human life. This is, I would say, a game-changing opportunity for pharmaceutical professionals like me and my colleagues here to make such a huge difference to human life and to change the course of this pandemic. Coming to the learnings that one can draw, I think one of the biggest learnings in this pandemic is the great collaboration that we have seen across various sectors in the society, right from the government to academia, to the pharmaceutical companies, within pharmaceutical companies, both the companies which produce the drug substance for the vaccine as well as the drug product, the medical community, NHS in case of UK. And I think this has led to probably one of the best vaccination programs in the world when we talk of UK. And I would say that India is not far behind, considering the fact that India deals with 1.3 billion population. I think India is also doing a great job. Another important learning is that, I somewhere feel that the pandemic has brought the world closer together. Although there is so much disparity between the reach of vaccines across the world, at the same time, we have also seen pharmaceutical companies and governments across the world really contributing to the poor countries getting access to vaccines, and I'm sure that this will accelerate even further. Also, I think apart from vaccines, the amount of sharing of information, whether it is the genetic code of the virus or whether it is cooperating on managing critical care patients suffering from COVID infections or exchange of medications across the world between one country and another. I think this has been a great example of unprecedented collaboration. Another big learning, and this I would say for the pharmaceutical industry, is some of you who have some knowledge of the industry would know that any new drug or a vaccine would take at least 10 or 12 years for development. Yeah? Here you have at least 4 or 5 vaccines approved by stringent regulators across the world and already being deployed in less than 1 year since the beginning of the pandemic. And this is unprecedented. And this could not have happened without the collaboration and the cooperation between various stakeholders across the industry. And I think this is another great learning for not only the pharmaceutical industry, but it is a learning for business in general, what collaboration can do and what we can do when we are facing a crisis and what human ingenuity and human spirit can achieve in adversity. So I think with this, I'll hand it over to you, Himanshu.
Thank you, Mr. Ravi. I think it's great to know that, today the VOCAD facility is able to produce 30% of the vaccine requirement of UK, and so that's amazing information. And I think you're right, absolutely. Not only in pharma, I think in medtech industry also we had the similar treatment given by the regulators, where many products or regulations were fast tracked so that these products could be used in different hospitals. So I think I agree that a great collaborative effort went between the industry and the regulators to reach where we are today. Thank you very much, Mr. Ravi, for your comments. I move to Mr. Mohammed Yasser, country head UK, Dr. Reddy's lab. Over to you, Mr. Mohammed, for your comments.
Yeah, thank you, Himanshuji. And thank you to CII for giving this opportunity. I think since the start of the pandemic, we have seen that the healthcare infrastructure has been stretched to the limit globally. And I think no other country has been excluded. Every country has actually struggled from meeting the demand. But what it has also created is it has actually created a backlog of a lot of non-COVID cases as well, because I would say we were so focused on COVID and other things. And I think that has created a huge backlog where they haven't received the required care and treatment. And I think it's very important for us to, as an industry, to, I would say, quickly build up capacity and then improve the efficiency and try to bring it up to the pre-pandemic level so that that backlog can basically come down and they get the required treatment which is necessary. And from a pharmacy industry point of view, what it basically means is that we could suddenly see an upsurge in demand for certain type of medicines. And I think we need to basically plan that surge and then bring that product accordingly, because otherwise what happens is you have the capacity in hospitals, but you may not have the right products to treat them. So basically you'll have to anticipate the demand in the market and then build stocks accordingly. And I think what has actually happened in the last 1.5 years, I think the supply chain teams in all pharmaceutical companies, they were stretched to the limit, because I think procuring any raw material in this scenario, in this environment where logistics became such a difficult challenge, was, I would say, quite a difficult task. But I think the whole industry actually has done quite well in being able to supply the required medicines at the right time. But what it has actually taught us is to basically look at and build some backup suppliers as well, and look at, I would say, backup manufacturing locations as well, because then you have better options for a faster turnaround, basically. And then as a silver lining, I think, like most of the other people have also touched upon, I think it has brought the world closer, and I think it shows what we can do when we face a crisis. And I think the industry, the hospitals, everyone did a fantastic job in developing and supplying products at a pace we have not seen in the past. Yeah, that's it from my side.
Yeah, thank you, Mr. Yasser. I think I totally agree. I think there are backlog cases everywhere in the world. And I think there's still a hesitancy to go to hospitals. And I think that is changing the demand scenario for many pharmaceutical products across many countries. And logistic problems still exist because it's still not gone away. And we see that challenge happening in medtech industry also, where the supply chain is currently badly affected, actually. So I'll give a short comment on the medtech industry. So I run a medtech company in India, and we manufacture a lot of medical devices. We're the largest exporter of consumer medical devices from India. And I also chair the CII National Medical Technology Forum, and where we have around 50 to 60 members. A lot of multinational companies, domestic companies are members of this forum. And I think the last 1.5 years have been very, very challenging for us. First of all, when we started in April, they were shorting the PPE kits, from masks to ventilators to everything possible we could think of. And because of the lockdown conditions, it was very hard to even start manufacturing in the country, because everything was shut down. But I think because of the efforts made by the government, a lot of efforts are made by CII itself, and with the collaboration of NITI Aayog and other ministries, we were able to quickly start manufacturing of PPE kits, masks, and even ventilators locally. And we were able to produce a lot of these products in a short time and meet the local demand. Otherwise, I think India was in a big trouble because of the supply chain issues we faced, of bringing these products from different countries. I think there is a need to innovate, and I think a lot of innovation is happening in the medtech industry. where we see, a lot of digitization, AI, big data, 3D printing playing a big role. And I think there's a huge opportunity between India and UK to collaborate. And I'll give you an example. My son is in the UK, just moved to UK, and he's coming across companies in the UK where they have R&D, they have new technologies, but they don't know where to manufacture them. So India, with these 4 medical technology parks which have come in, and I think the AP MedTech zone, which is up there, which is up and running, where many companies are out there manufacturing products. So India offers a great opportunity to companies in the UK to work and collaborate together with Indian companies and make products in India, and not for India itself, but also for the world. And these 4 medtech parks are already announced by the government. The government of India also announced a PLI scheme for making medtech products in India. So there's some incentivization happening in India for making a lot of medical devices in India. So that is also another area of a collaboration where UK companies can come in and even start manufacturing in India, and taking advantage of this PLI scheme. And I think there are a lot of capabilities which can be leveraged between the companies. And today, for example, our company, we a lot of our products are today approved at NHS, and we are supplying many products in infusion and vascular access accessories. So I think Indian companies are capable to make world-class products, and the capability exists because today, if you look at manpower cost, we are the cheapest in the world. In terms of engineering talent, we have the best talents in the world, whether it's hardware or software. So across the board, India offers a great opportunity for this, collaborative activities between the companies based on in both the countries, and we see that happening already. And I think there's a lot of opportunity to to take this forward. In fact, India has set up a goal that by 2030, India should be self-reliant in medical technology, and I think UK can play a very important role in that area, where UK companies which have technology, I think great technology exists there. There could be a local collaboration between the companies, where companies could transfer technology, bring in technology, and then make those products in India. So I think that is where I would invite UK companies to come and visit these medtech zones, collaborate with local companies, because there is a lot of opportunity sitting out there. And I think also there's a today China plus one strategy. A lot of companies which were making products in China, and I think because of the current supply chain issues and logistic issues, I think India, because of a vast coastline we have today, a lot of manufacturing plants can come around in those areas where we have special zones for manufacturing medtech products. So that's another area which we think which is coming up. A lot of opportunity for contract manufacturing, for Indian companies. So that's another area for collaboration, I would say. And I think there is a need for regulator dialogue, because today Indian regulatory roadmap is already set up. Our regulatory, let's say our NDR rules are complying with the latest NDR guidelines, and we comply with the total regulatory framework has been designed on global best practices. Our regulations are harmonized with global regulation. So if there is a regulator dialogue, I think a lot of approvals can be fast tracked, as UK is moving to its own regulatory regime, as it's moved out of the EU. So I think this kind of dialogue would help us to fast track UK companies to move into India in terms of selling their products, and Indian companies to move into UK to sell their products there. So I think that is what I look forward to, and I think we encourage from CII side a continued engagement between UK and Indian governments on improving ease of doing business in both the countries, and India has moved quite a lot in terms of ease of doing business. So as UK, as I can see, two pharma colleagues sitting there and running large companies out there, large manufacturing facilities, and I think, and some of the Indian companies have gone to UK and bought some companies out there. They're collaborating there. So I think there's enough to do both sides, and I think many UK companies operate in India today, in terms of selling the products in India or even manufacturing in India. So India can become a big hub in future for health tech hub, and I think there is an opportunity for integration of technology between healthcare and engineering and medtech, and then and become like a global service provider to companies out there in different zones, different territories, and I think there is a lot of opportunity in terms of skill development. I think a lot of skill building can happen, a lot of skill transfer can happen from UK to India and vice versa. So I think many opportunities exist between the two countries, and I'll encourage, and I think we have Consul General Birmingham, Dr. Shashank Vikram here, and of course he's having a seminar. So, and I'll request you, sir, to maybe set up a dialogue between CII and the consulate, that how we can bring medtech companies to India, to British companies to India, and Indian companies to UK, and enhance that cooperation and co-development and co-manufacturing and co-invention between the two countries. Thank you very much, sir. Now I'll come back with this to our fellow panelists, and I think I'll go to Dr. Michael Joseph. Here, you have talked about the role of industry, academia, cooperation when it comes to global health. So how do you see that? How do we enhance partnerships? Between our hospitals, research labs, academic institutions, between India and UK. How do we take this forward?
Thank you, Himanshuji. Fantastic question. I just want to give a small example where just after COVID, we actually had a molecular testing device. From our university, we have biomedical engineers and virologists working together. And then we actually invited applications here from SMEs in the UK for manufacturing support and commercialization. Then finally, we signed up a deal with an SME here in southeastern England. So similar approach. Again, Reviji, I did not know your presence at that time. Forgive me for my poor knowledge here. So again, in the opportunities like this, I see great potentials for Indian organizations. If it's registered in the UK, it's easier. But having said that, we also have signed partnership agreement in Sri Lanka, for example, for the same molecular, testing device we have designed. So that's one opportunity for commercialization. Number two, I would say Innovate UK funding for, like I supported, I'm not boasting, I worked until 3 o'clock in the morning in May 2020 to submit Innovate UK application for an SME, and they got funding. One was for device, and other one was for Space Republic for office port, COVID-resistant office port. Again, that, and you get, the SMEs get 70% of the funding. Universities only get 30%, from Innovate UK. Again, that collaborative research innovation support to generate data, to validate your proof of concept. I mean, there's a fantastic opportunity. Again, I'm happy to discuss this separately, Himanshuji and CII, your medical technology group, how we could work together on that area.
For sure, definitely, Dr. Michael, we'll reach out to you separately through CII, and maybe have a separate discussion on this. And I see a lot of ideas floating in my mind right now. So I'll talk to the CII team and especially connect with you. I'll come to Dr. Madhukar Bose. Thank you very much, Dr. Michael. I'll come to Dr. Madhukar Bose. I think some of the important areas of future collaborations are in digital health, telemedicine, AI, and machine-assisted skilling and R&D. And probably help the audience understand within the area what would be partnership look like between India and UK, and what could be the benefits that the population of both the regions could expect. So I think that's a very important question, because we've all seen, and I think you talked about it already. So maybe a little bit of more elaboration would help, actually.
Thanks, Himanshu. I mean, there are a number of areas where there's a lot of potential.
Yeah.
I mean, there's a well-known shortage of data scientists, for example, when it comes to the creation of AI. I mean, the UK has data assets, but the shortage of data professionals means that there's a great opportunity for India to step up, train these young minds, and then they're out into that global market where there is such a high demand for for that sort of skills. And I think the other areas would also be around how India can create more of a sort of a national initiative around data repositories and data access, because that has been one of the UK's great strengths. Not only creating the data assets, but also enabling access to that through a set of rules and controls. So I think those are areas where I think a lot can be done. There is already a lot of cross-fertilization of, as you were alluding to earlier as well, of companies going out, in fact, working with Apollo Group in certain instances. So I think those are two things I just wanted to kind of flag up off the top of my head. But of course, there are a number of other things as well. But I think those two stand out for me.
Yeah, I think you're right. Absolutely. I think through our COVID app, I think we are collecting loads of data right now. And I think, and I think it's important that how UK has, evolved or, in using that data and how data privacy was maintained and, how it was shared between, organizations. So I think all that is a very important area of collaborative efforts which can be done between India and UK. And I think I see, great learnings, on both sides on this area actually. And thank you, Dr. Madhukar Bose. And I'll now move to Dr. Shashank Vikram, a Consul General of India in Birmingham. I think India and UK have announced a new enhanced deal on trade at a virtual summit. A deal aims to double the trade between the two countries by 2030 and declares joint commitment to start working towards a comprehensive free trade agreement. So for which discussions are due to commence very shortly. I think I've also seen a media article, just a few days ago. So what should be our, goals towards this comprehensive free trade agreement? So Dr. Shashank, your views on that, and then probably, we'll ask CII to, compile some of their views from their members, and then we can go back to the government and then, at least put the industry viewpoint there.
Yes. No, as you very rightly mentioned, actually, when it comes to the India and UK, the vision for 2030, as you know, there is already a vision. And as part of that, healthcare sector has been identified as one of the priority sectors. And within that, you see the government of India's, I would say, consistent effort has been for ensuring accessible healthcare to all. And when you talk of that in present scenario, it is primary, secondary, tertiary healthcare. It is also the increasing need for training, which obviously India has a lot of strength, of R&D, of innovations, of taking those innovations to a level where they could be implemented at an industrial scale. And also when it comes to the pharma, to medical devices and all, we are already doing quite well. But I feel that I think it was you who was mentioning that your son, when he came to UK and he discovered that this is something which I have also noticed, because that is the innovations and disruptions, they might happen at a place, but in order to take it to a certain level, you need a partner. And the same thing I can say can also be very well in case of Indian R&D, where you have some innovation and disruption, but it may require some input from a second party. So it is within that context, I feel that the India-UK collaboration has a lot of potential. And that is why it remains a priority area. And that is why I feel that whenever and we hope that FTA also comes to, I would say, life soon. And there is a consistent effort for that. And healthcare sector forms a very important aspect of it. But any such, I would say, going forward, if you ask me, it will again go back to the very same things. There should be a matching of complementarities. There should be no issues when it comes to the flow of men, material, and ideas. When it comes to those, we already, I think, know what are the constraint points when it comes to healthcare sector. And I think all of them are being addressed and identified. We also very well know what are the priorities in healthcare as far as India is concerned and as far as UK is concerned. We also very well know that the two health systems, here if we compare NHS with our system, which as you know, is a mixture of private and public, and has several layers and dimensions to it. What they can learn from each other, that also I think over the years people have realized and identified. The next step only needs to be seen that how this will be implemented, and government has already shown its intention by declaring it a priority area and clearly outlining it in the dialogue as we go forward.
No, I think we are looking forward to that. I think there are great opportunities between the two, and even in healthcare sector or medtech sector, I see massive opportunities going forward. And from the industry side, I think we'll collect all the comments from all CII members and board members, and also give our viewpoint that what we think should be part of the free trade agreement as an industry body, and how we can scale up the opportunities. I think that there are a lot of areas to scale up. Even let's say for our company, we see that we can triple our trade by 2030. What we're doing in UK right now, we can triple it actually by 2030. So that's the opportunity I see right now. And I think that's also for likewise for companies in UK to work in India. And I think there's a similar opportunity existing for those companies. So I think massive opportunity exists. Thank you very much, sir, for your comments. Ravi, I'll come to you. And I just want to understand, do you see any regulatory challenges between India and UK relationships specific to, let's say, manufacturing or to the pharmaceutical sector? Do you see any challenges, and can there be suggestions to remove those challenges?
I won't say there are regulatory challenges.
Yeah.
Although it's important to understand that UK is a regulated market governed by the MHRA,
right.
Which has a mutual recognition with most of the other stringent regulators like, say, EMA or US FDA. And the compliance and quality expectations in a regulated environment are obviously very different, and at a level higher than what we are used to in the developing world. Yeah. So I won't say it's a challenge, but it's about inculcating a quality culture in a company to be able to operate in an environment which is so stringent in terms of its regulatory standards. I think that's what it's all about. And Indian companies have done well, not only in UK, but also in US and in Europe. And obviously, over the last several years, the Indian pharmaceutical industry has evolved and has been able to compete with the best in the world in all these regulated markets. And we are one of the biggest suppliers of generic products in the world, as you know, whether it is US or Europe or UK. And we are also making very rapid inroads in complex molecules like biosimilars, etc. So I think we're doing well.
Great. I think good to know. And I think, of course, we have the highest number of US FDA approved plants outside US and India. So I think Indian companies do understand the regulatory landscape, at least in the Western world, very well. So I think, and many of them done. I think medtech is one area which is very new, I think, and I think that is where we need to scale up and scale up our regulatory landscape, and in terms of India, because we are still evolving in medtech sector. I think that is one area we will have to improve a lot, I think. So thank you for your comments, and I'll come to you, Mr. Yasser. What are the collaboration opportunities you see between India and UK companies going forward? Because you present a very large Indian pharma company. So what are the collaboration opportunities do you see between India and UK right now from your end?
I would say more it is from a supply point of view. We could also see more, I would say, on the R&D front as well, because what happened at Dr. Disease, we did a lot of, I would say, collaboration with companies globally as well to basically get COVID products out to the reach of people globally. We went ahead and did the Russian vaccine as well. So such kind of opportunities can come in, and we could work on basically co-development or such activities between both countries.
I think R&D is one key area. I think where even in medtech space, I have seen that companies like TCS, HCL, Wipro are doing a lot of R&D work, I think, for companies, but that is not directly impacting the medtech, sector in India actually, because they were standalone R&D for companies in UK or in other other Western countries. So I think that's one big area which can really grow at a very higher level going forward, even in medtech space actually.
I had one comment on the question you actually asked to Ravi, because any product that is manufactured in India, it doesn't actually need a separate testing in US. US authorities would directly accept a testing that is done in India. But that's not the case with UK, because normally once a product comes from India, it has to be separately tested in UK as well, which actually reduces our responsiveness or probably makes us slower compared to some of the other companies, because normally when you bring in and test it, it takes 2 weeks time or something. That means in case of a shortage, the patient has to wait for it. So I think because obviously Indian companies also have stringent quality standards, I think somewhere if this kind of requirement can be limited or reduced, it would actually make us more faster in response, especially in situations like these.
Correct. And I think we have seen this in the case of IVD especially, where every IVD product coming to India has been tested at NIB, and it could take between 30 to 45 days. And especially at the time of pandemic, a lot of these products are needed on urgent basis for testing, doing various tests. So I think I hear your point very well here. So if the regulators can collaborate, if the product is approved in the UK and it's already tested, then there's no need for testing in India. Or if it is tested in India and passes all the qualification regulatory requirements, then there's no need for testing in UK, for example. I think that kind of collaboration is very important, especially during these times. I think we are running out of time, and I've got prompted by the CII team. It's already an hour, just exceeded by a minute. So I'd like to thank all the panelists once again for your comments. And I think it was a very interactive session. And I think a lot of learnings to take, from both sides, whether people are listening to this, seminar in India or whether people are listening in the UK. And I think we are very, distinguished panelists who spoke about various things. And I think I'll ask you to collate all the information and separately connect. Each one of you separately if there is specific information needed by members, to move forward this dialogue. Thank you very much once again, and thank you, and have a nice afternoon and evening. Thank you.
Thank you.
Thank you.
Thank you, everyone. Cheers. Bye.
दिल धीरे धीरे धड़के आज फिर होने को है आगाज़ सफर पर चलने का बढ़ने का इतना है हौसला जितना भी फासला मंजिल तय मिल ही जाना है हम में है
हौसले पे सवार आगे बढ़ रहा है इंडिया और इसे रफ्तार दे रहे हैं 10 करोड़ हीरोज।
The best way to predict the future is to create it. And in India, one name has been doing it for more than a quarter of a century now. Airtel. Where pioneering is not just a word on a page, but a feeling in our guts. A feeling that pulses through us every single day as we push the digital transformation movement in this country. We were the first to launch GPRS and pioneered the 3G wave before breaking through with the 4G revolution that changed the way every man, woman and child connected to the future. And today, we stand on the cusp of a new frontier, 5G. For over a year, some of India's finest minds have been innovating on technology solutions that will not only raise the bar on connectivity, but also cross it when the time is right. And today, in the city of Hyderabad, we become India's first telecom company to demonstrate a live 5G service over a commercial network at speeds that can allow anyone to download an entire movie in seconds. This is a moment that marks India's first step as a global power in 5G innovation, and we stand committed to lead the nation to that goal. For